I wear scleral lenses. This is my case compared to a regular contact case. My scleral lenses are specifically made for dry eyes. They cover majority of my eye, which is why they can't fit into the average contacts clear care case. These actually took quite some time for me to get used to applying into my eye because of how large they are. I was taught by my contact provider to use the opposite hand of whichever contact you're applying to that side. So if I used my left hand, I would put it into my right eye. And then my right hand for my left eye, I have to lean over and then get my elbow as close to a 90-degree angle as possible. And it makes it a lot easier to line it up with your eye. And then you have to open your bottom and your top lid in order to get it in there smoothly. As you can see, I did add a few drops of preservative-free eye drop in there, and that was a suggestion from a fellow scleral lens user due to dry eye syndrome, and it helps with the clouding. It don't get as dirty as easy. So it's been working a little bit for me. So I can say that even though these are life-saving, like I would not be able to live my day-to-day life without these contacts, because I would just be in so much pain because my eyes just don't produce tears at all. Like I literally can't even cry. They just turn red. So with that said, I'm very thankful for these things. It is kind of annoying I have to clean them periodically, but I'll take that versus having to struggle with seeing. It is crazy though, because I have no idea what caused this. It started in 2020 and I went 3 years going to several different doctors. They were trying to treat my eyes to get my eyes to basically produce more tears, and nothing worked. Finally, my last doctor, he suggested scleral lenses for me, and I was desperate at that point, so I was not about to pass up that opportunity. While they are expensive and they are not covered by insurance, I feel like it's very much worth the out-of-pocket that they do ask. I have had them for about a year, and I still periodically mess up and have to apply it 2 to 3 times just because I get a bubble, and it does hurt. Also, when you have scleral lenses, they are pretty pricey to keep up with. You have to buy the clear care. Every 3 months, I have to purchase the Pros clear case off of the dry eye shop. And then I have a special disinfecting solution that helps get off the debris that builds up on it. So I use that maybe like every 3 days. But yeah, they're so much worth it. So if you have a problem like I do, I would definitely suggest investing into it. But yeah, this is what it looks like after. And I feel a lot better once I put these in. Thanks for watching.